Let's shift gears a little. And Elizabeth, I want you to address some of the challenges that we have in this population of Dravet and LGS as far as taking medications. What are some of the barriers that these kids have and how can we address them?
Actually, for a lot of patients, there are several barriers. Start with these kids, most of them are on more than just one medication. And so if we stop and think about the number of pills we're actually asking these kids to take a couple times a day, so sometimes it's shockingly overwhelming to me, quite a large number. And oftentimes it's a problem. Some kids can't swallow pills. Some kids refuse to swallow pills. And also some people might just have difficulty with oral motor function being able to swallow. So our nurses are actually very good at working with patients, trying to figure out what strategies will work. And I'm always impressed that parents can also be pretty creative. We have one of my kids who's probably on 4 medications a day, refuses to take them. The only way the child will take them if the parents kind of crush up everything and put all the pills together in one capsule, they're able to get the child to take that. So that's a huge amount of effort for that family to do that every day, which is, I think, one reason and I think also the pharmaceutical industry realizes that we need formulations other than pills for many of our patients.
What are some of the issues when you alluded to it, but what about when you try to have them mix it with food? I'm always concerned that, what if they don't eat the whole portion of the food that has the medication in?
Oh, no, that's a big concern. Or if they put the medication in a liquid, what if that doesn't get all of it? Or what if some of the medication sticks to the container?
Yeah.
I think it's a big concern. And that's one way, I guess, it can't be, I guess you consider if it was always a reliable loss, you could kind of guesstimate by following levels of the medications, et cetera. But I think that does concern the parents. The other thing is, gee, if Johnny always will take his medication in applesauce because he likes applesauce, what if he then starts hating applesauce because the medication's always in it?
Right.
And that also happens not infrequently. The child will become adverse to different foods, even their favorite foods, because that's how they've been receiving their medicine.
Well, and Elizabeth talks about how pharmaceutical companies have now started to address this in a more novel way. Eric, tell me and talk about some of the newer formulations and ideas that have been brought forward recently.
Well, one of the most recent that is very attractive and I think is a gold mine for, if you're a parent, you don't have to have Lennox-Gastaut. If you give your kid an antibiotic, sometimes you find your spouse holding and the other one giving the dose, and it's a battle. So when we give that, both my wife and I, pediatric epileptologists, we think about our patients that have to do this day after day. And you have to put yourself in that position. So one of the delivery systems that is new and could potentially be helpful, not just for anticonvulsants, but for medications in general, is the Aquestive technology, the film delivery. And I have actually tested it in a couple of patients with Lennox-Gastaut because they offer a particular challenge. One, just like kids, they don't like to take medications many times. Sometimes if they're cognitively impaired, which is often a comorbidity, they don't understand why it's so important, so there's not like a reasoning about taking it. So the medication may fly. Then we talk about dysphagia, and dysphagia with liquid is worse. So liquid is just a possible option for the person that prefers liquid over tablet, which is usually a child, but not the dysphagia. But the fact of having a film technology that dissolves in your tongue and you're not able to spit it out is incredible. So that hopefully will be something that expands to other medications. At this point, it's just trying to have an absorption through the GI, but in the future, maybe a rescue medication, this technology, because they have something called permeating engineering technology, which can go through the mucosa. So that's a great thing. Short from that, we do what was mentioned earlier. So I particularly like, my kids like Nutella. So if you can crush it at a small thing and put it in a small amount of Nutella, they take it and hides the flavor. So you have to find something like that, but the tricky part is that the kids are smart. Even with cognitive regression, if you try too hard to give a medication, they know something is there. So you have to be very careful about how to deliver a medication, and it's clearly a challenge. So.
And just to say, a lot of our kids also are on the ketogenic diet, and so that inhibits our ability to use things like Nutella, and so that adds an extra layer of complexity.
Yeah, that's a really good point. And Elizabeth, I wondered if you could spend a couple minutes on the challenges of dietary therapies in combination with some of the medicines and how you overcome some of these barriers in your practice.
So I have been a zealot for dietary therapy for epilepsy now for 20 years. It's been a big focus of what I've always done, both the classic ketogenic diet and low glycemic index treatment. And I think diet can be wicked effective in treating epilepsy, almost any type of epilepsy, including Lennox-Gastaut, including Dravet. The difficulty when it comes to medications is many of our medications contain carbohydrates. So being on a diet, the child can't get any liquid formulation because they all have sugar unless we have it compounded. And even some of our solid pill form medications have a lot of carbs. So that goes into the kind of the calculation of the diet. But that's something centers who do the diet know how to do. And that's usually pretty easy to troubleshoot that. So we frequently use the diet in combination with our medications.
That's great.